A story that Fox 17 has been keeping you updated on now for several weeks. Changes coming to our state's no-fault auto law that advocates say could drastically limit access to quality medical care for survivors of catastrophic crashes.
Michael Martin has been staying on top of this as we get closer to that July 2nd deadline when these new rules go into effect. He's live now outside the state capitol with the latest from today. Michael.
Yeah, Doug, Janice, good evening. We've brought you story after story of survivors of catastrophic auto crashes terrified at what these changes coming on after July 1st will mean in terms of their access to quality medical care. After July 1st, that new set of medical fee schedules takes effect. And on Wednesday, advocates say they've already got a list of 15 to 20 care providers that'll have to close their doors once it takes effect.
We're down to the wire. We're running out of time. We're almost out of time.
Back at the state capitol on Wednesday, more than a dozen survivors of catastrophic auto crashes continue their fight for lawmakers to take action ahead of changes coming to Michigan's no-fault auto law after July 1st.
Most of us have worked really hard to get where we are. Through months and years of rehabilitation to be able to be functioning members of society.
At this point, I'm frustrated. I don't know how we're going to proceed from here.
Frustrated because the new law intended to lower car insurance rates will introduce a new set of medical fee schedules, meaning that local care providers like Nick Long's NeuroCare Home Health will now only be reimbursed by insurance companies at 55% of what they were being reimbursed for in 2019.
We're going to do as much as we can financially. We are going to lose thousands of dollars to make payroll every week. Eventually that will run out and we'll go out of business.
The reduced reimbursement rates apply to any post-acute medical care that isn't covered under our federal Medicare Act, putting many of these Michigan-based care providers in a precarious situation.
I have a list of about 15 to 20 companies that are closing their doors or, as I mentioned, discharging patients with auto insurance funding.
Tom Judd, president of the Michigan Brain Injury Provider Council, says with these companies shutting down, 680 patients will be immediately impacted and over 1,400 people will lose their jobs.
That's people right now forecasting and getting out before July 1. There's a lot of companies that are going to try and hold on, hope for a miracle, serve as best they can, cut their resources, and try and make it work.
As these providers close their doors, people like Lori Alexa are left wondering how they'll care for their loved ones, such as her son Danny, who was injured in a crash in 2003.
So on June 30th, I'm on my own to provide his care 24/7, replacing 5 skilled nurses. So I'm going to do that all night and then be awake all day to care for him. And so, he's going to end up in the hospital. And how is that cost effective and how is that fair to him?
Some lawmakers have suggested that care providers negotiate individual contracts with insurance companies. It's an approach that Tom Judd says many insurance providers are so far not willing to consider.
We dropped off a memo with hard evidence from 7 different companies who have made declaratory statements they are not negotiating with medical providers, that they will not negotiate with medical providers before July 1.
There have so far been 3 separate bills introduced into the state legislature that would provide a fix to the new fee schedules, all of them so far languishing in committees. Governor Whitmer on Wednesday, when we asked her about the status of a legislative fix.
I've been open to a narrow way to address the rate structure. I think that makes sense, but ultimately we've got to negotiate with the legislature at this point. I think they're still negotiating among themselves to see if they're going to give us a solution to the problem.
So advocates now concerned that the legislature will fail to act on any of those 3 bills before they take their summer recess. Now, the hope is that they can somehow legislatively kick the can down the road, per se. We don't know in terms of how that would actually happen at this point. We did reach out to the Michigan Insurance Alliance for a comment, who did not return our request at this time. We'll bring you that on our web story when we hear back. For now, though, in our state capitol, Michael Martin, Fox 17 News.